Hello, good afternoon, everyone. Good afternoon. Thank you for joining today. I'm sorry to be a few minutes late. I was just finishing wrapping something up. So again, thank you guys for joining today. We're going to get started in just a few seconds. Today we're going to be talking about IUDs. Over the last few weeks, we've had a lot of questions come up about intrauterine devices. That's what IUDs stand for. And so thank you for joining. As you come into today's Sunday Chat with Dr. Madeline, please be sure to wave or type hello for me in the chat box. I love to know that you're here so that I can give you a personal welcome. So again, welcome to today's Sunday Chat with Dr. Madeline. We'll be getting started soon. Let me just make sure you guys can hear me okay. And okay. All right. Okay. Great. Hello, everyone. Thanks for joining today. As you join, please type your name or send me a wave or a hello into the chat box. That way I know you're here and I can welcome you personally. Thank you so much for being here. Hey, Teresa, thank you so much for being here. I appreciate you. Awesome. Today we're going to be talking about intrauterine devices. And so, or IUDs. They are, IUDs is short for intrauterine devices. And we're going to be talking about them because I've had several questions in the last few weeks about, what they are, how they help women who are thinking about long-term birth control. So again, thanks for joining. We're going to get started in just a few seconds. And I have props today. I love the days. Hey, Yvette. Hey, Sans. Thank you so much for joining. We're going to be talking about IUDs today. And I have an actual IUD that I'm going to show you guys and also talk a little bit about what happens when an IUD is inserted. So thank you guys for joining. Let's go ahead and get started. Sorry I was a few minutes late today. I was just finishing up something, wrapping something up. Okay? All right. So, hello. My name is Dr. Madeline, your board-certified OBGYN, international speaker, and published author. I help very busy women try to access the GYN care and birth control that they need so that they can have the maximum amount of control and freedom over their lives. Okay, and by doing that, I just allow them to be able to access things more easily, including information. So please, if you are on other media channels, follow me on Instagram, Twitter, and Facebook at Dr. Madeline MD. That's DrMadeline MD. Okay? So again, thank you for being here. Let's go ahead and get started. Because IUDs or intrauterine devices are something that they come up very often when I'm talking to women about birth control options. And so also, if you're here and you have any friends in your world, friends who are reproductive age, that's anywhere from age 11 when we first have our cycle to age 51 when for most of us the cycle ends, please feel free to share this video with them, okay? So the three things I want you to know about IUDs that we're going to talk about today. The first one is that there are several different types of IUDs on the market today, and the ones that are on the market are deemed to be very safe and they're FDA approved, and we're going to talk some more about the history of IUDs and about some of the bad rap that some of the older IUDs had, okay? So that's the first thing I want you to know, that there are several IUDs on the market today. The second thing I want you to know is that the IUDs that are deemed safe on the market today can be in your uterus anywhere from 3 years as far out to 12 years, okay? And we're going to talk about some of the different ones and which ones can be in for that amount of time. The third thing I want you to know about IUDs is that even though they can be in your uterus for from 3 to 5 years, and they are safe and effective being in for that long, if you at any point in the window of those years change your mind or decide you no longer want to have this IUD in, it is absolutely okay for you to say to your GYN or your care provider, your midwife, your nurse practitioner, hey, I think I want to have this IUD out. Are there other options? Okay? So those are the three things we're going to talk about. First, let's talk about a little bit of history, because IUDs which again I like today because I have some actual props for you guys. So it's basically, this is like a version of what one would look like. This is the actual size that it would be, and there are versions that are plastic, and there are versions that have some copper wrap around them. Okay, so just to give you guys some history, a lot of times when I'm talking with patients about IUDs, some patients are hesitant to even consider an IUD because of some of the history that went along with IUDs. So let's talk about what that history is. So are any of you familiar with Dalcon Shield? Have you heard of the Dalcon Shield? As others join us today, please feel free to wave or type your name into the chat box. That way I know you're here and I can welcome you personally. So again, thank you guys for joining. I see we have some other people who have joined. So if you have not heard of the Dalcon Shield, let me tell you about it a little bit. So the Dalcon Shield was an IUD that was developed in the 1970s. Oh, okay. Thank you, Yvette. Yvette says she hasn't heard of it. Patricia, thank you for being here. Patricia says she has. Teresa says she has not heard of it. Well, thank you guys. Hey, thank you for being here, Patricia. So the Dalcon Shield was an intrauterine device that was very popular. In fact, it was one of the only ones out there back in the 1970s. So it was, it looked almost kind of like a little claw almost. Hey sis, how you doing, Joan? Thank you for joining today. I appreciate you being here. We're talking about intrauterine devices today, guys. And, you know, when used correctly, IUDs can definitely help with worry-free sex or getting long-term birth control. Okay, great. Joan says she has never heard of it. Okay, great. Let's talk about what the Dalcon Shield was. So it was a different type of IUD. It was one that almost looked like a little crab with little claws. It had little claws in it, and what happened was women liked it, you know, because it was used for birth control back in the day when we didn't really have many options. So just to give you a big picture about what was going on in the 1970s. Before the 1960s, women didn't really have options in terms of birth control. I mean, yes, we had some different home remedies that we did, but the birth control pill wasn't discovered or established until the 1960s, okay? And then the birth control pills that were out back then had really high formulations of hormones. A lot of women that were involved in birth control pill studies had bad outcomes. A lot of times it was related to the hormone levels being too high. If you've ever heard about some unethical studies that went on in Puerto Rico and in some parts of this country, it had to do with the fact that a lot of times women didn't fully understand the risks that they were taking by taking these early versions of birth control pills, okay? So in the 1970s, when this IUD came out, people looked at it as an option to the birth control pill, thinking and hoping that it would be safer. Also thinking and hoping, you know, the birth control pill is something you have to take every day. What people like about the IUD is that once it's in there, you don't have to think about it every day. But the challenge with the Dalcon Shield in the 1970s is that, you know, the way it was made, this little kind of clawed-looking device that would go and sit into the uterus, and the string that it was attached to, all IUDs have a string that sits outside of the cervix, and it's what we use when it's time to remove the IUD. We grab the string and we just pull it out so that it makes it very easy to remove. But the string that was on the Dalcon Shield was made with a type of filament that would allow bacteria to get in and grow. And once those bacteria got in and grew, they were causing pelvic inflammations, okay? So a lot of times, so when you hear people talk about the Dalcon Shield, if you've never heard people talk about it before, when you hear women share with other women that they don't recommend the IUD or that they heard stories that someone had an infection or had a bad outcome, I guarantee you they're usually talking about the Dalcon Shield. Now, Dalcon Shield, you know, had a lot of reports of pelvic inflammation, pelvic inflammatory disease. Sometimes it led to such severe inflammation and inflammatory disease that women had to have surgeries to have their uterus removed. That's how bad that infection could get with the Dalcon Shield. And so the Dalcon Shield was actually taken off the market in the mid-1970s. So that's important to note, that when you're seeing your provider, if you're asking questions about IUDs, or some of the younger women in your lives who are still a reproductive age who are asking questions, if you're asking about an IUD, Dalcon Shield is no longer on the market, okay? It was taken off the market. It was deemed to not be safe for women, and so that was removed. The newer IUDs that are on the market many of them were FDA approved. Another thing to know is that in the 1970s, when the Dalcon Shield was made available, the Federal Drug Administration, FDA, was not yet in the habit or in the practice of approving devices, medical devices. So the Dalcon Shield was not reviewed by the FDA and deemed to be appropriate. All of the devices that are on the market now were developed in the mid-1980s, and that's the window after which FDA began reviewing and approving medical devices. Okay, so that's important to know. All the IUDs that are on the market today have been reviewed and approved by the FDA. They've been deemed to be safe. Okay, the Dalcon Shield was not, but it had been, developed in medical scientific studies, and they said, okay, well, let's put it out there. It'll help women. So again, that's a difference with the Dalcon Shield, which is no longer on the market, but likely tied to those stories that you might hear from, our aunties, older relatives who talk about an IUD not being safe or causing infection. It was likely the Dalcon Shield that they were talking about, that IUD that was out in the 1970s. Teresa has a question. She says, what are the age range for using the IUD? Excellent question, Teresa, because we've learned more as we've come along. Hi, Dr. Cecilia. Thank you for being here. Thank you. Loving the history of IUDs. So, Teresa, excellent question, because what we know and recommend about IUDs in women of all ages has evolved over time. So I would say let's go back to even 15, 20 years ago, when I was first getting out of residency and reviewing and understanding things. It was actually believed that adolescents should not use IUDs because there were concerns about it negatively affecting their future fertility. There were concerns about women who had never before had a pregnancy using an IUD because it might not be the right method for her. But I will tell you that in the time that I've been practicing, I would say over the last 5 to 8 years, we've learned a lot more about IUDs. And so the answer to your question is, what is the age range for using an IUD? Any age range. So we now have different IUDs. Remember, I told you the first thing I wanted you guys to be aware of is that we have multiple types of IUDs on the market today. So there are some, Skyla is one of them. It is one of the smaller ones. It can last for about 3 years, and that's one of the ones that is recommended or made smaller so that it can be used in someone who's a teenager or someone who has never before had a baby pass through their uterus or cervical canal. Okay, so nowadays they have more IUDs available for women all across the age range. So let's stay on that one, because again, that's the first thing of the 3 things that I want you to know, that there are multiple types of IUDs on the market today. So the IUDs fall into 2 categories. One type of IUD has hormones in it, or just the progestin, no estrogen in any IUD. The other IUD, of which there's only one, is the Paragard. That one has no hormones, but it has some copper around the IUD. And so the ones that have hormones in them, a lot of people like the ones that have hormones in them because the hormone dosage is usually pretty mild. But what happens is the hormone that's on that IUD that can sit in place for a number of years, what it does is it prevents your ovaries from releasing an egg. Now, what happens over time, and this is great for women who like having milder periods, or for some women, their period goes away altogether. I have some patients that love that side effect of it. What happens is that over time, your period can go away. But, this IUD, it sits in the intrauterine cavity, and it basically releases the hormone gradually, slowly, over a number of years, whatever the number of years is that it's supposed to be in there. One of the ones that's becoming more popular these days is the Liletta. That's another type of IUD. That one can be in place as long as 7 years, and again, it has the amount of hormone that will be slowly released over time. The main reason people love IUDs, yes, is for birth control, for contraception. But if you are someone who has a heavier cycle, Liletta or Mirena IUD is very good because it has hormones in it, which is going to over time decrease your flow. And also, if you tend to have a lot of cramping or pain with your cycle, these types of hormonal IUDs are great. Okay, so that's the first thing I wanted to cover today in terms of there are several types of IUDs. So the second thing I wanted to cover today is that the IUDs can be in place for as little as 3 years to as long as 12 years. So the one that can be in place for 12 years is the one that doesn't have any hormones in it. So just to give you a little bit of detail about that one. So the Paragard IUD, which is the one that doesn't have any hormones, that's the one that is wrapped by a little bit of copper. It doesn't work by, it does suppress ovulation, but what happens is the copper, the sperm doesn't like copper. So if the sperm makes it through your cervix, it tries to thicken the cervical mucus a little bit, but if the sperm makes it through your cervix and is there in your intrauterine cavity, it's not going to have the same motility that it would normally have to go rush out and find that egg. You know, usually, and you guys know, sperm are very good about finding an egg. If it's there somewhere, they're going to try their best to try to find it. But when you have an IUD in place, it decreases the ability of that sperm to reach that egg. Okay, that's how it works as birth control, by decreasing that ability. So sometimes people ask about how the IUD is placed, and I just want to share this with you because I happen to have this device here. So again, this is a real life size of an IUD. So you can see that it's very small. It's not meant to be something that is going to cause you an excessive amount of discomfort. When it's in your uterus, you shouldn't feel it at all. Sometimes you might have, if you have a male sex partner, sometimes they might say, oh, I felt the string when we were having sex. Okay, that's very rare, but sometimes some men will say that. So you can always, if someone is feeling your string during sexual intercourse, you can ask your provider to trim the string a little bit. So I want to just show you what happens when we insert this IUD. Okay, so this is a long device. Sometimes when patients see this, they're like, oh my God, is all that going in me? No, it's just a long device because everything inside has to be sterile. So what happens is we measure how large your uterus is. Most of the uteri are about, maybe this big. And then we put this, let me show you with this. So this is like a little uterus, okay? And so then we basically insert this device through the vagina, up through the cervix, into the uterus. And again, the little green thing is the inside of the uterus. Then what we do is we release the arms of the IUD. Okay, we can do all this in the office, and a lot of times I tell patients to take some Motrin before the procedure, because if anything they might have a little cramping, but it shouldn't be really very painful. So we release the arms of the IUD and then we push it all the way up, okay, so that it's at the top of the uterus, and then basically we remove the device, okay, and then when you remove the whole device, we cut the string. Sorry, I pulled it a little bit. So, but yeah, we cut the string, and basically that string sits out of your cervix, and that's what we trim and what we grab onto when it's time to remove the IUD. Okay? So I just wanted you guys to see that, because sometimes people think it's a bigger and scarier thing than it is, and it's actually one of the simplest procedures we do in the office. It takes pretty much 10 minutes or less to insert an IUD, okay? And if someone has had their Motrin beforehand, they most times what will happen is patients will say, oh my goodness, is it in already? I didn't even feel it. And so that's what happens most times when someone is getting an IUD placed. So again, the three things I wanted to go over with you There are multiple types of IUDs. We talked about a couple of them. Skyla for kind of younger, maybe adolescent women or women who've never had a pregnancy because it's a little bit smaller and it stays in for a shorter amount of time, 3 years. Liletta and Mirena can be in for as long as 7 years. And the other type of IUD is the Paragard, which has no hormones. It has just copper. That one is especially great for women for whom having hormones is not a good idea. Depending on what's going on with someone's medical history, if they have high blood pressure. High blood pressure is more so a contraindication for estrogen, but sometimes women are like, I don't want anything extra in my system. And if that's the case, the copper or the Paragard IUD is a great option for them. Okay? The second thing we talked about is that IUDs can be in place safely and effectively. Effectively means they will prevent pregnancy for that entire time. So they can be in place for between 3 years and 12 years. Okay? And the third thing I wanted you guys to know, which is very important because sometimes people feel a lot of pressure when they have the IUD put in. By pressure, I mean, let's say they have a 10-year IUD in, but at year 2, they're like, I'm not really feeling this device anymore. I think I want to change. Or let's say they have one of the hormonal ones. Now, I mentioned that one of the side effects that people generally like is that it can sometimes stop your period altogether when you've had it in for a while. Some people don't like that. I've had some patients come in and they say, I'm not comfortable with this because every month I'm worried that I'm pregnant because I'm not seeing my period. That's okay. If you want to have that IUD removed and you've had it in for less than the optimum amount of time or the maximum amount of time that it can be in, it's absolutely okay. It's important that you feel that you have a provider with whom you feel comfortable with talking about the fact that you want to explore a different birth control option. That's very, very important, okay? So ladies, I want you to always feel empowered that whether you choose an IUD or some other form of birth control, that when and if you change your mind, that you feel empowered to let your provider know so that you guys can talk about what the different options are and talk about whether or not you want to have an IUD removed to try something else, okay? So that's what I wanted to talk with you about today in terms of IUDs. I hope that you guys received the information. I hope I provided some clarity about the Dalcon Shield. Again, it was probably something that, in the 70s that maybe our parents and our grandparents were very familiar with. And again, when you hear people, a lot of times women come and they have ideas already about certain types of birth control based on what family members have shared and what they've heard from other people. And I just wanted to reassure you that the Dalcon Shield is no longer on the market. When we're talking with you or when you're talking with your provider about an intrauterine device or an IUD, we're only talking about ones that were developed and FDA approved starting in the mid-1980s to today. And, the good thing is they're always different drug companies are always working on different ways to improve IUDs, maybe to make them have different types of drugs, make them have hormones in them that have less side effects. Let me mention that to you as well. The number one side effect for people to be aware of, and that if you're aware of and can deal with for the first few months, is some irregular bleeding, more so with the hormonal IUDs. And so what does that mean? So when you first have an IUD put in, even if you have an IUD put in that's eventually going to lead to less bleeding, in those first few months you're likely going to have some irregular spotting. You might have a period or two that's a little bit heavier than usual. For most of my patients, if they get to the 6-month mark and they're okay in terms of having managed through those initial months of side effects, they love the IUD, okay? An IUD, because it can provide you years worth of birth control without you having to think about a pill to take every day or a patch to put on every week or a vaginal ring to insert into your vagina every week, many people love it for that reason. And whenever you have a birth control option that you don't have to think about every day, that's more aligned with having worry-free sex, okay? When you have something that you have to think about every day that you might forget to take, when I was taking the pill, I shared this with y'all before, I was awful with trying to remember to take the pill. I also had the IUD after I had given birth to my 3 children, and it worked very well. So just remember that if if you're in a space in your life when you're trying to figure out how do I have more worry-free sex, then think about birth control options that allow you years of protection, okay? Today we talked about the IUD as one of those methods. In another Sunday chat with Dr. Madeline, we'll talk about Norplant, or the little implant that goes in your arm, as one of those methods that can give you years worth of birth control protection. So that's what I wanted you guys to know about IUDs today. So I hope you guys have gotten some information that you will share with others, or that might help you on your own personal journey for birth control information. If you have any other questions, please type them in the chat, and just let me know if anything else came to mind in terms of questions about IUDs or intrauterine devices. And again, I want to thank all of you for being here. Teresa, Yvette, Patricia, Joan, and Dr. Cecilia, thank you guys for being here. Okay, well, if there are no other questions, I'm going to go ahead and wrap up. So next week, just to give you guys a heads up, we're going to be talking about hormone replacement therapy. We've had a couple of questions in the last few weeks where people had questions about, hormone replacement therapy as an option when there's vaginal dryness or hot flashes or menopausal symptoms. So we'll spend some time talking about that next week, okay? So, in conclusion today, again, I want to thank all of you for being here. I appreciate y'all so much. I am Dr. Madeline, your board-certified OBGYN, international speaker, and published author. I help busy women access tailored GYN care and birth control that they need to have the maximum freedom and control over their lives. Please, if you are on different social media platforms, follow me on Instagram, Facebook, and Twitter at Dr. Madeline MD. That's DrMadeline Again, thank you so much for being here. I love y'all. Enjoy the rest of your Sunday. Thank you, Dr. Cecilia. Thank you. Okay, bye-bye.